As a nurse, we all have had many different types of preceptors, and I've had my fair share as well. Some teaching methods I've enjoyed, others I have not. And one method that I found when I was in anesthesia school was a CRNA who taught with stories. He shared his experience, we discussed what went wrong, what went right, and I took that to heart. And when I have students now, I teach with stories through my experiences. And that's one thing Sabrina and I have done with Hello Nurses, is that we've tried to use our stories, use our experience to hopefully increase the reader's knowledge, to ultimately increase patient care. So we hope you follow us along, and we're all here for the patient.
Never let your dreams be controlled by these three things: the past, other people, and money.
I never
Covering anesthesia on the weekend can be unique, and it's what I get to see as far as the caseload, and it can be taxing emotionally. I just finished a case that was a code in the OR, transferred the patient back to the room where they ultimately passed within a couple minutes, to walking into a new room where it was a mother excited about the birth of their child, and trying to suppress my feelings from the previous case and have them be kind of sidelined till I can take care of this epidural for this mom. So it can be challenging sometimes. I think it's important to have somebody to talk to about these things later on. But in the moment, it can be difficult. I think in this case, it was maybe 5 minutes from when I left a code to putting an epidural in. So I've often been called to rooms where patient is in respiratory distress, and I've seen the bag valve mask set like this and hands like this and ventilating. Not ideal. So what you want to do, quick fix, 2 thumbs on either side of the mask, third finger, middle finger on both hands, lift up on the mandible just a little bit, and have that second person go ahead and ventilate. All right, trying this again. I had a little trouble before. My screen looks very different now. So maybe this will work better. All right. We spent a lot of time over the last 48 hours discussing things that I do as a CRNA on a daily basis. We also wanted to go over what it was like for us as a family during anesthesia school.
In all of our years of education, we have always had little ones at home, and to our knowledge, there aren't a lot of resources out there for people doing just that. And so we created something called Books and Babies, and it will give you a peek into how we went about accomplishing our goals, but also balancing family at home. So we hope that the resource will be helpful for you.
So check it out. All the proceeds for the first 2 weeks will go to Inspire a Nurse, which was created to help those on the front line.